Welcome back, everybody. Eyelid surgery can help improve the overall appearance of your eyelid, rejuvenate the areas surrounding your eyes, or help with functional problems. Dr. Cordestani is a good friend of us here at KMR Local 4. We're glad to have you back in with AOMS. We were talking about the surgery off camera, and this is something people would get this surgery for a lot of different reasons.
That's actually very true, Andy. The main thing is, I think a lot of people, and not to downplay it, surgery is surgery.
Right.
So when you don't have respect for surgery, you tend to fall into complications. So everybody goes with the idea you go to someone who's well-trained, someone who has a lot of experience. That being as the foundation or the baseline, then you go, okay, I need this surgery. In regards to the complexity of procedures that we do, a blepharoplasty or surgery for the eyelid is actually fairly easy.
Again. And this is something you'd go in, we're talking about 30 minutes in and out?
Well, some of it is.
Yeah.
You know, for example, we were talking about, off camera, it's very common as you get older, you tend to get a lot of skin stretch, skin falling down, especially in the upper eyelids. Okay. And a lot of people think, oh my gosh, I got to go get new glasses. Well, glasses aren't going to necessarily help when you have skin blocking your vision.
Blocking your vision, yeah.
And then what happens is, surprising, a lot of those people come in saying, oh, I just was found out it's not my vision, it's the skin blocking my vision. And we tend to do those, the upper blephs is a very common procedure done, and that takes a very short time. Yeah,
so you do upper and you can do lower if that is the place. But in terms of recovery time, what are we looking at?
Patients basically go home within a couple of hours. We take out the sutures within about 6 days, and then basically they're a little bit bruised.
And that's it?
And that's it.
And this is done pretty much under local, right?
Some of it can be done under local. Some people, if you're anxious, we have the options to actually do it under more of a general setting. Okay. Because that's the last thing you want is somebody being nervous and having surgery. Right. So, but yeah.
Like, hook the IV in, I'll see you in 30 minutes. Good night, everybody. That's more along my speed. Exactly. Well, how do we know, what do they need to do if they feel like, hey, this is something that I might be interested in doing? What do they need to do? Well,
it's something simple. Like, we have actually trained professionals who are our patient coordinators. So what they need to do is just give us a call at the office. And, our job is not to sell. It's not cars. We don't sell stuff. So our job is to bring them in, take a look at them. If, in fact, they have the right story, if, in fact, they need the operation, then we go to the second stage where we say, okay, now that we've established you need it and we can do it, let's talk about how to do this.
It's not one of these deals where you're like, hey, listen, what's it going to take to get your eyelids done today? It's not that at all. It's taking everything into consideration. Yes. And let me tell you something, you will absolutely love AOMS. If you go in there, the work that you guys do is just incredible. It's just a good group. So if you have any questions about that or anything remotely even close to that kind of surgery, give my friends a call over there, 806-322-LIFT. That's 322-5438. Dr. Cordestani, we always appreciate it when we get to catch up with you. Stick around. It's time to head into the kitchen. Chef Bud Anderson is